Thank you, Mike. Well, we're talking tonight about dental implants, something we hear about quite a bit, and Dr. Dennis Myers is here to fill us in, let us know what they're all about and when they might be appropriate.
Well, implants have been coming along for the last 30 years more commonly, and certainly for the last 20. And the exciting thing is that one of the few things in medical treatment that are actually coming down in cost. So plus they're so much easier for patients to have and so much easier for dentists to do now.
So quite a few benefits to implants, and there's something called mini implants. What are those?
Mini implants are kind of something that's arisen, was usually designed for one particular case, and that's to secure a lower denture. Where patients, I like to use the analogy, you know, the discs that you have when you slide down the hill in the snow. Well, some people's lower denture just slide around like that, and they have a hard time, obviously, think about what that would be like to try to chew that way.
Yeah.
And these we can use to secure a lower denture, and all of a sudden, boom, they can chew again much more.
So what is the actual process? Is something is actually drilled into the gums, or how does that work?
It's actually, it just screws in. And it's something that can be loaded that very same day. It's painless procedure. We numb the patient. We had a patient the other day that we did one, and his wife told us that he didn't even take an aspirin that night.
Well,
so
these can even be used, you mentioned an implant if you have a tooth missing, or you just want to do one tooth. You don't necessarily have to think of these as dentures.
Yeah, mini implants aren't for everyone, but they're certainly expanding. It's probably the fastest growing type of dental implant going now, because you have to avoid, you don't have to have bone transplants from the hip or from a rib. It used to be, they were quite involved surgeries, multiple surgeries involved in having implants, but not so much anymore. Some people still have to have that. But this is something that most people can avail themselves of rather than the hospitalized type care.
All right, and if someone is interested in implants, they just need to call your office and you can let them know what the process would be.
Right, and just a simple x-ray can tell whether or not they're a candidate, and most people, more and more people are.
All right, Dr. Dennis Myers, thanks for coming in tonight.